Welcome back to The Blend. They're there with you every step of the way to help you get back on your feet. Good Shepherd Integrated Healthcare Services. They provide continuity in care that helps you or your loved one from heading back to the hospital. And here with a look at what Good Shepherd offers is Lee McCormick and Kevin Minchin. It's great having both of you. Welcome in.
Thank you for having us.
So tell us about Good Shepherd and what you offer.
Well, we've been in business for 15 years. We started out actually as a rehabilitation center. And about 10 years ago, we decided that we wanted to get into the home health services. So we could provide that continuity of care.
Absolutely.
So when a patient comes out of a hospital, they're not really, happy to try to take care of themselves in the home. We come in with our professionals, our clinicians, and we get them back on their feet and keep them strong and
just be that helping hand that helps them through the process rather than regressing and heading back to the hospital.
Well, and we do both because we have skilled nursing and we also have home aides. So, we'll do whatever we can to get them back on their feet.
What makes Good Shepherd's home health different than others you might see?
Well, I think because we have 4 outpatient rehabilitation clinics. So when a primary care physician or care coordinator refers them to us, we start with the home health and we establish a relationship with the patient. Ask any caregiver and they'll tell you that once a patient is home, they don't want to get out of the chair.
Yeah.
And so they have to call and say, we need you to make sure that you get your full services. So we've already got an established relationship with them. They are more likely to go to one of our outpatient rehab clinics.
Yeah.
We specialize in cardiac and respiratory. We do everything.
And we're actually looking at some of the services that you offer right now on screen. Kevin, when people come to your facility, what can patients expect?
Yeah, the biggest thing we want is them to be comfortable.
Yeah.
So when they walk in, they're greeted by our staff right away. We want it to be a friendly environment. From there, they come back. If they're a cardiac patient, we're always monitoring your vitals. We do that 3 times throughout a treatment. What we do is we hook you up to a monitor, allowing us to track the rhythm of your heart while you're there.
Oh, wow.
From the other side of things, from our respiratory patients, we'll hook you up to oxygen via our concentrators. A lot of patients may not feel they could get back to a gym and have fear that they don't have their oxygen or their monitors, they're not hooked up to a monitor, so they don't know if their heart is in a proper condition for them. So this allows them to feel comfortable. And
gives them a little peace of mind.
Absolutely. And what we're really focused on is that they can become individualized throughout the treatment. Our goal is for them to go back to a community facility, but a lot of times they'll fear that they won't know what exercises to do or is it safe, particularly if they had an open heart surgery. That's a life-altering event.
Of course.
So these patients come to us and confide in us. And a lot of times, they get comfortable with the people around them. It doesnn't feel like a gym-type setting. They're more so going through things, becoming friends with some of the other patients. We take them through A through Z, vitals, all the way through different exercises where one person's program is different from the next based on their goals. So we're always having a conversation with the patient to make sure we're achieving their goals and progressing them so that they feel safe.
No question. And it's worth noting, by the way, while you do help people of all ages, seniors are not the exception to the rule. They are almost the rule. A lot of your patients are seniors, aren't they?
A good majority.
Yeah.
But I treat a lot of physical therapy patients as well,
Yeah.
some workers' comp cases. I would say our age ranges from 40 to your mid to upper 90s.
Wow.
It's really for anyone. We'll gear it towards your needs.
Absolutely. You're going to be at the Spotlight Spectacular this weekend?
Absolutely. We are the only people who provide glucose testing. So we invite everybody to come down.
So if you want to get your glucose tested.
Have your glucose tested. You would be surprised how many people don't know their numbers.
Well, there's a lot of, the numbers in America, supposedly, a lot of people that are pre-diabetic or diabetic don't know that they are.
And they're afraid to do it.
Because, if you don't hear it,
exactly,
it doesn't,
then it's not real.
Of course.
And so I have a very seductive face, and Nina always gives us extra chairs so that they're comfortable, and and because the spectacular is huge.
Of course.
And people walking around and standing for a long period of time, have a seat, please have a seat, and we'll give you blood pressure, and we'll test your glucose, and I tell everybody we promise only good numbers.
Yeah.
And because they're a little nervous about
course.
it, and I say, oh, be brave, be brave. You
Yeah.
can do this. And
It's worth noting. I mean, information is power. If you get that information, you find that you're diabetic or pre-diabetic, you can then take some action on that and improve your health and improve your life.
it's actually very rewarding to see the look on their faces when they discover that they're okay.
Just rip the Band-Aid. Rip the Band-Aid. It'll be fine. If we want to learn more, your information is right there on the screen. It's great having you.
Thank you
so
so
much.
much.
Appreciate
Pleasure.
it.
Good Shepherd Integrated Healthcare Services has 4 Valley locations. You can head to the website on your screen to find one near you or call the number listed. They're also on Facebook. Good Shepherd Integrated Healthcare, a proud sponsor of the Morning Blend.